welcome to the official podcast of MISSABCON 2024. I'm your host Nikhil Harsh, and today we'll be diving deep into the most anticipated and awaited medical conferences of the year, which is the Minimally Invasive Spine Surgeons Associations of Bharat Conference, or as we know is MISSABCON 2024. MISSAB is an organization that focuses primarily on the patient outcomes. And in today's discussions, we have the experts on the panel, and let me introduce all the panelists right here who have joined us today for this discussion. We have the president of MISSAB, Dr. Amit Jhala sir, the consultant spine surgeon, HCG Hospital, Ahmedabad. We have Dr. Bharat R. Dave sir, consultant spine surgeon, Stavya Spine Hospital, Ahmedabad. We have Dr. Hitesh Modi, consultant spine surgeon, Stavya Spine Hospital, Ahmedabad. We have Dr. Neeraj Vasavda, consultant spine surgeon, Zydus Hospital, Ahmedabad. We have Dr. Rakesh Luhana, who has joined us on the Zoom call, who is the consultant spine surgeon, Venus Hospital, Vadodara. We have Dr. Subir Jhaveri, consultant spine surgeon, Dr. Subir Jhaveri Spine Hospital, Ahmedabad. We have Dr. Jigar Anandjiwala, consultant spine surgeon, Vivan Hospital, Ahmedabad. We have Dr. Mayur Wala from Spine Medicus Spine Hospital, Ahmedabad. We have Dr. Ajay Krishnan, consultant spine surgeon, Stavya Spine Hospital, Ahmedabad. And I welcome all of you right here in this beautiful discussion that we are about to have and share our insights to our viewers.
So we have Dr. Hamid Abbasi from US, and we have Dr. Marcelo from Brazil. We have Dr. Arvind Kulkarni, who has joined from Mumbai. He is a prominent leader in MISSAB and quite active. We have Dr. Palani Kumar. He is from Tamil Nadu, down south. He is again a minimally invasive surgeon there.
All right. So about this conference and about the discussion, it is going to be a very, very informative discussion for all our viewers and for the attendees who are about to come in this conference, which is happening in very short time. So let's dive into it. And to kick things off, I have a question, and I would like to ask this question to Dr. Mayur Wala. Could you please share a short introduction to MISSABCON 2024? What is the conference about? And why it is a very important and essential event for spine surgeons and also for healthcare professionals. Could you please share with our viewers?
Yeah, this conference actually focuses on marvels of the spine surgery, where the techniques and technologies which are evolving in the field of the spine surgery is going to get highlighted, and the newcomers or the person who is involved in the field of the spine surgery, they can go through and they can learn a lot out of all these things which is going to happen in this conference.
Superb, and it sounds very exciting and amazing. So coming to the milestones, if we talk about the milestones, I think spine surgery has come a long way in this decade. Especially the minimally invasive technology is coming in. So how will it, help the patient care?
Okay, so first of all, I would like to say that there are very important milestones in spine surgery.
Right.
If you see spine surgery, it has developed for more than 100 years. But the biggest important part is that decompression of the nerve for which the patient is coming, which was the main goal in 1950s and before.
Right.
After that, the understanding of the spine increased, and then we required the stabilization of spine. So from 1960s to 1990, stabilization of the spine evolved over and above the decompression.
Right.
One very important part, as on today, it's very important for diagnostics of spine, and the MRI, and that MRI is a game changer in spine.
Right.
And which started after about 1980s and 1990s. The MRI became a big investigative tool where the spine problems were diagnosed frequently, and that's the main diagnostic tool for spine. Then in 1990s or end of the 1990 and 2000, the biggest development came was the achievement of the milestone of minimally invasive spine surgery. So since last 25 years, it has evolved its place as the major, which was not a gold standard, now it is going to become a gold standard in spine surgery, which is again, I think, is the future of the spine surgery. So these are all the milestones and evolution and development of the spine surgery. All these minimally invasive techniques, they are very, very important for some like safety, which is the prime, the patient comes for the safety in spine surgery. So safety, accuracy, early rehabilitation, less pain, less muscle damage, early return to work, they are all the biggest advantages. So there is a big boom among the spine surgeons to learn, to apply their skills and sharpen their skills, to apply and sharpen their skills for minimally spine surgery. This conference, MISSABCON, is going to bridge this gap between the surgeons who are already into it. They will share their knowledge to the surgeons who are already into the minimally spine surgery. But for the younger generations who want to take on this further in their clinical practice, there are going to be a lot of cadaveric workshops, lot of training methodologies, and they can adapt this technique and practice in their clinical practice. So that's a big boon for even the young surgeons to attend this meeting.
Sounds amazing, and I'm sure that the viewers who are actually looking and listening to us, they would be really interested to come here and learn so many things that you already mentioned. So we talked about the milestones. Now I would like to ask this question to Dr. Rakesh Luhana, who has joined us on the Zoom call, and talking about the technologies that you already mentioned. And the minimally invasive technology that has really changed the way medical spine surgery is working. So my question to Dr. Rakesh Luhana would be, what do you think, sir, what would be the next key generation techniques and technologies that will be highlighted during the conference? And also my question would be that how do you think that they are expected to impact the future of minimally invasive spine surgery? So let's hear it from Dr. Rakesh Luhana.
Yeah, thank you. So in last decade or so, many newer techniques have come up. So we are going to discuss about all of them, like tubular spine surgery, which is really a minimally invasive surgery done through a microscope and using tubular retractor. We are also going to discuss about monoportal endoscopic surgery, which is ultra minimally invasive surgery, where one can do quite a good number of surgery through a very small single portal. And there is another advancement called biportal endoscopy, which is another type of endoscopy which is catching up really fast. We are also going to discuss about OLLIF. Dr. Hamid Abbasi himself from USA would be here, and he would be demonstrating this technology, which is very ultra minimally invasive interbody fusion technique. Apart from this, we are going to talk about the Standu endoscopy technique, as well as disc replacement and anterolateral approaches. So in a recent generation, the technology and techniques that has changed the outcome of spine surgery, and in near future, they are going to change outcome in a better way. Those all things are going to be covered in this MISSABCON 2024. Thank you. Dr. Hamid Abbasi suggested that probably he might have to leave, so let's hear from him as well what he is expecting from MISSABCON and what he has to say about MISSABCON. Dr. Abbasi.
First of all, thank you very much for having me on this forum. It's always a privilege to be among the top-notch surgeons in the world, and that is exactly what I observed last year when I was privileged and honored to be in MISSABCON in 2023. I was amazed and in shock and awe how much skills and how much expertise our Indian colleagues have accumulated. The endoscopy and minimal invasive surgery has come a long way because of your effort. And that is what I have been telling to my colleagues in the United States since then. India has the most bright future with all the human, especially in the spine surgery. And I'm really honored to be part of this fantastic development. More importantly, what I see India is that taking this natural place, not only in delivering the spine care, but as well developing the spine technology further. And I'm really honored to be there soon and share our knowledge and gain more knowledge with your expertise.
See, Ahmedabad is a Gangotri of minimal access surgery. So the whole society, the spark was lighted there about 10 years back. And we are going back to the origins. And so that was a right opening because, you've been leaders in minimal access surgery, Amit, Bharat, yourself, Subir, Neeraj, Hitesh, almost everybody have been pioneers in minimal access spine surgery, and it's good to go and again go back to Ahmedabad and learn from you guys the newer take homes, in terms of the robotics that you're engaging in minimal access surgery, the way you are using navigation. Most of you have adopted endoscopic techniques, so it will be a big revolution. And not only for, what you can call the senior surgeons like us, but also I think the newer generations will be looking forward to this cutting edge conference.
I'm a transforaminal and interlaminar full endoscopic surgeon from Tamil Nadu, which is in the southernmost part of India. Already this group is star-studded, and with people like Hamid Abbasi sir and Marcio sir and all these people going to grace us, I am sure it is already a success. When I see the list of talks and other things put up by the group and by Dr. Ajay Krishnan, I can see that everything has been taken care of, right from the latest in-technique things to artificial intelligence to robotics to the basic workshops wherein everybody who is starting will get good hands-on and everything. I am honored truly, and I would like to contribute in whichever way the committee feels me that I should do it. Thank you very much.
That's great, Palani. Thanks for being here. Professor Marcelo from Brazil, welcome. Thank you for being here. How do you take up coming to India from that long, and what are you up to?
Well, it's a very long trip, as you know. So about the MS procedures, I have no doubt that so far we don't have any questions that is the best way to treat our patients. But the point is, how far can we go through full endoscopy? That is the point. Because to me, the full endoscopy is the best way to treat a lot of spinal diseases. And I can assure you guys that so far I have a nice experience with benign spine tumors, spinal metastasis, all of them managed through full endoscopy. And on the single incision shorter than 1 centimeter, we can treat spinal fracture. So that is the point. We are dealing with immunocompetent patients. So the risk of infection in the post-op is too high. Full endoscopy is a conception, and you must bring the full endoscopy for your daily activities. Full endoscopy is not a procedure of exception, okay? If you do not perform at least one per week or two, I have no doubt that you would not extend your indications for treat your patients on the full endoscopy. But I will show you in the MISSABCON Congress that we can go much, much further beyond under this conception. Another point, I'm bringing this, I don't know how you guys are familiarized with the entrapment of L5S1 by fibrosis. Because it's pathology quite neglected. We got a lot of patients now suffering from sciatic. And you do not point at the compression because you're not well familiarized with these signals. So you point for endoscopy to treat that kind of patient. We have a lot of patients now with entrapment by this fibrosis provoked by a chronic inflammatory process, L5S1. And it's going to be very exciting to show you how to manage that kind of patients and bring the benefits of the full endoscopy to treat all of them. So thank you so much for your time.
So yes, MISSABCON 2024 is packed with a lot of activities and very informative and technical sessions as well. So my question to Dr. Hitesh Modi would be, what are the key highlights and the activities that we are about to see in this conference?
Thank you very much. I think MISSABCON, as you have mentioned, that it is packed with sessions and activities. There are few highlights which I think everybody should know, that we have 160 plus experts, as Dr. Mayurwala already mentioned. They will share the cutting edge technologies and innovations in spine surgery, particularly I will say in minimal invasive spine surgeries. We have 23 plus international faculties coming across the world, and they will share their knowledge to boost our learning experience much better. 15 plus key opinion leaders from across India, they are also sharing the knowledge with us, and it will help us in developing professionally as well as clinically more and more as a surgeon. There are 130 plus national leaders working in minimal invasive spine surgery, 16 fresh porcine cadaver stations from which the delegate will learn about performing minimal invasive surgeries in the beginning stage. Overall, there are 250 plus talks on advanced technologies and techniques of minimal invasive spine surgeries, 150 plus free papers showcasing the pioneer research work in minimal invasive spine surgery. There are 350 plus attendees, including delegates as well as faculties, and 25 plus companies. They will be demonstrating innovative products in minimal invasive spine surgery. It is an exceptional networking opportunity for all, including surgeons as well as the industries. Last but not the least, the grand location in the capital city of Gujarat, which is Hotel Leela Gandhinagar, which will serve the purpose. Along with, there are also some interesting sessions like the Garba or Gala events. They will also boost up the conference more. So I would say that there are ample of reasons and highlights in the conference why one should not miss the opportunity to attend MISSABCON 2024. Thank you.
Lovely, sounds amazing. I think there are so many activities and some experiences that attendees won't even forget when they attend MISSABCON 2024. So coming to the structure of this conference, when it is divided in 4 days, so I would like to ask Dr. Ajay Krishnan this question. Could you please guide us that how will be the structure of this conference and some key highlights about day 1, day 2, day 3, and what will happen?
So basically we have made it a long and divided conference and tried to accommodate learning points for almost all from juniors to seniors. So we have the first day which is focused more towards the workshops, and the second, third and fourth day is more towards the individual sessions of 6 key techniques which we are going to discuss in the main hall. At the same time, parallelly we have the hall C, wherein the more advances on techniques and technology will be discussed. And what you need to more focus is that there is a workshop which is going on in animal lab on porcine cadavers, wherein there are already 185 registrants and we have 16 stations. So that is a big number of stations and 4 to 5 delegates per table which is there. So there is ample time for interaction for each of the delegates who want to pick up a particular procedure, and they will be dedicatedly put into that session for nearly 2 hours. So that is the workshop part. Then on the same day we have the boot camp, which is an iSpine collaborated event, and in that we have a very good basic know-how of all technologies what is there into MISS, which Dr. Amit Jala has already talked about how we have evolved. On the same day we have NSpine. NSpine is again a teaching organization in the Europe and coming in a big way, and they are coming to collaborate with us and take it big further. So that is NSpine there on the first day itself. So this is a major thing, and all the other days you have specific those key technologies being taken up, and at the same time the details of specific sessions. It's not mixing up, everybody can individually learn that particular technique and technology in that session. And there is something which is very much encouraging is that workshops have never been more than half day in any of the conferences. We have a full day of workshop on day 1. Moreover, on the second day and the third day, that is to say on 17th and 18th also, the workshop is open for any of the companies who are participating in our conference to again pick up the delegates and one-to-one interact with them and show their techniques on the cadaver, which has never happened before. So these are the specific way as to how to take home more learning for the delegates, even for companies, and of course the peer learning.
Sounds very exciting about the journey of the 4 days that the conference is about to have. Coming to Dr. Bharat R. Dave sir, I would like to know from you that because MISSABCON 2024 has a wide range of technical knowledge and opportunities that have been given to learn from this conference, how would you like to guide us that even the seasoned surgeons and also the students who will be participating, what will be their key takeaways from this conference that we have?
Well, I think this is a great education event. It's been designed by Dr. Ajay, Dr. Amit, and as mentioned by Dr. Hitesh in such a way that it is going to cater the seasoned surgeon as well as somebody who wants to pick up this speciality. So it has got the cadaver workshop as mentioned, and 1:4 ratio. So for 4 students, there is going to be 1 faculty who will be demonstrating on the day 1 workshop. At the same time, there are going to be 31 prizes. So that also will attract lot of delegates who want to present their work, and they will be numbered as well and they will be awarded as well. So basically the MISSABCON is a great education event for both seasoned and the new learner as well.
Superb, right. And as we all know that MISSABCON 2024 also have a lot of experts from all over the world, not just India. So my question to you, sir, Ajay sir, that what do you think that the role of the faculty would be in this conference? If you can tell us.
So we have 23 faculties international who are joining us, and there are good number of around 65 to 100 learning faculties, senior faculties who are joining from India itself. So it's a big conglomerate of experts at the same place.
So about the kind of learning and the role of the faculty would be in this particular conference, from all over the world there'll be attendees also, and the faculties would be. So please guide us on that.
So we have credit points which have been given from the National Council. We have applied for the European credit additional points, which probably will be getting over, and that has added many of the international participants who are joining us, because it has never been before that international participants as delegates joining us. So that is an encouraging thing, because the learning is tougher in the outside of India, there is more learning opportunities in India. The workshops are quite reasonably priced, and the ratios of the surgeon to the teacher is quite high. So that makes the learning takeaways very high. So this is why more of international participants have shown their interest, and they are actually participating and coming forward to MISSABCON 2024.
Right.
May I add something to that?
Yes, sir, please.
So this is a wonderful opportunity for everybody. In context of our Prime Minister who promotes Vasudhaiva Kutumbakam, right? So this is kind of a family which is getting together. It's a spine family. Every region, the faculties coming from US, Brazil, from Europe, from East Asia, even Africa, so all these countries are facing their own challenges. They have their unique solutions for their particular region. So it's an opportunity to have a kind of a Kumbh Mela of this, expertise, and jot down a proper plan which can benefit an individual patient. At the same time, again in sync with India Shining, we can showcase where we stand. We are nowhere behind to any of this international podiums, may it be US, may it be Europe, may it be anywhere in the world. I think, India is at par with everybody. So this conference not only can amalgamate something good from the Westerners or the other faculties, we can even give back to them, today. That is the stage we have reached. So that conference is very, very nicely portraying this part of our grown-up, developed country.
Very well said. And as we know that Vasudhaiva Kutumbakam will have a lot of people from all around the world, and Indian flag is always shining
absolutely.
high, as we all
Absolutely.
are proud about it.
Absolutely.
Yes. And coming back to this conference, there are a lot of submissions for papers and the presentations as well. So I would like to ask Dr. Subir, if you could please guide us about the important part of the paper presentations and also the poster presentations, and you could please guide everyone about the process of the submissions and what all awards and recognitions would the contributors be getting by submitting their work.
Basically, the research forms the crux of any conference. Most of the people who come, they have an innate desire to go onto the podium. So the juniors, they are all usually doing a lot of research for their mentors, and when they get this opportunity to present, that is what they actually look for. So we have almost more than 185 submissions, of which 160 are going to get presented. Some may get e-posters, but most of them will be going on to the podium. And in order to provide an incentive, what we have devised is that each and every technique, there will be a best paper presentation. There will also be the best publication award also, whichever has also been published will get an award. Then there will be the innovation award, the best innovation. If somebody has come up with a new specific, something new in their technique, then they'll be given a best innovation award as well. So there are so many such, and even if somebody has made the best presentation, so those are the things that will incentivize the newer generation. And as Dr. Bharat said, there are total 31 awards to be given out. So there is a lot that they will take away. Besides having an opportunity to interact and network with all the seniors from India as well as abroad, there is a lot that they will take away from this.
Yes, correct. What do you think from the past conferences that you have attended? And I would like to ask you that such attendees have come along with their submissions. What are their reactions when they receive such recognitions and awards?
Whenever actually, even if your paper gets accepted, that's a big achievement for the juniors or even the seniors who have, and that's a big thing because it's one of the most advanced meeting that we are organizing. And when you get to present your research among all the stalwarts coming from all over the world as well as all the big national faculties, I think the sense of achievement is great. not only for the juniors, but also for the seniors who are presenting their work.
Mainly it is because there's a lot of effort that goes into making one paper. It starts from getting and collecting data, researching it, sending it to your mentor, reviewing it. So lot of man hours go into making one paper. That's the reason why this appreciation is very important.
And it's a stage where you can present something which you feel is a novelty, which you feel that you have studied in depth, and presenting in front of your peers for critical evaluation whether you are doing right or wrong. If you are doing right, some other people can also learn out of it. So that getting accepted, my research is something which is I will cherish for my life.
True, so true. And could you please guide us about the process with which they can, submit their work or research paper or the paper presentation?
I think we are already beyond that process, because the conference is coming up very shortly, and this process of application and then submission followed by review. Usually it is reviewed by 4 faculty and they are marked separately, and then the averages are taken out, and once the average is there, you have the one that is the best. So then you are it's like a descending order. Depending upon the technique, a descending order list is maintained, and then how many of them will go for presentation. The remaining, if suppose 8 are going, then the next 8 will go for e-posters, and then if there is anything beyond in the same area, they will get rejected. So we have tried and accommodate most of them in this conference.
Superb. So as we can see, it's a incredible conference that is going to happen, MISSABCON 2024. So I would like to ask Dr. Ajay Krishnan about, I'm sure that the spine surgeons and the students and all the attendees are very excited to, come and join in as the attendees of this conference. So could you please guide us about the registration process? How can they, register their spot? And the key deadlines that they have for the registration as well for this conference, and of course, how can they get their spot in the conference?
We opened up the registration quite early, nearly a year back, and what we were up to is we introduced something as the Smart Bird registration. Okay. So you would have heard something as early bird registration. It was even
smart
before that.
Early bird. So smart early bird.
So that made the registration very cheap and very cost friendly for those who were looking up to this conference as an annual conference to participate. So that was a bonus for them. Then progressively we had the early bird, we had the regular bird, and now we are towards the spot registration, which the cost is going to raise. And this will, because we are heading towards the conference very fast in coming 2 weeks. So what we will lose is that if we go on to the next week, we are going to sit on a spot registration which will come at a very high cost. So those who are listening should join the conference as soon as possible. The registration process is very simple, and it is very well mentioned inside and carried through the website. You can go on, click the registration process, choose the category which you are into, whether you are a member, a non-member, you are coming with a companion, spouse, or you just want a registration. These all categories are there, and a permutation combination is there with the residential package which is there at Leela. The more and most stressed thing which everybody should realize is that this is a 4-day package. Usually the conferences come with a 3-day package. So even if it is seemingly a premium price, you have to understand that the workshop is coming free to you. That is one. And the most important part is it is 4 days than the usual 2.5 days which is coming to you. So at a small escalated price, that package is very big for anybody who is joining us. So don't wait, just join us, please.
And go on to MISSABCON 2024 and register.
So I think they can go on MISSABCON2024.in and register themselves. And I think, sir, as you mentioned, smart birds, the early birds, And those after them also, they were very lucky to get into this at very cheaper price, because the workshops, the boot camps, the seminars, and what all things that they'll be getting would be, priceless. Yes.
One more thing I would like to add is that the members had a very huge benefit to save out money, and at this point also somebody is getting a membership into MISSAB, where rewarded with a discounted registration, and so that encouraged lot of registrants, and we could get good members to the progressive society. That was something which we could appreciate, and it was quite big a load.
Superb. Sounds amazing. And now the advancements, sir, as you already mentioned, in minimally invasive spine surgery, the techniques and the technologies have been incredible these days. So I would like to ask Dr. Jigar Anandjiwala about this. So these innovations and technologies, how would they impact patient care that we are facing today? And also we would like to know about from you, in what ways that we expect the improvement in the quality of life of human beings or individuals, for say, suffering from especially spine diseases.
So the patients who are going to be the endpoint of all the results. So patients who require spine surgery, the minimal invasive spine surgery, or the MISS, which we call, for that the conference is going on, they will be benefited many ways. Like that, there will be very less or shorter hospital stay, so the recovery will be very faster. There will be very less pain after surgery, because due to the MISS techniques, because there is a limited tissue and muscle damage. There will be very less scar on the skin after surgery, because other than the routine open traditional surgery where the long big scar is there, where the reduced blood loss and reduce infection rate to the patients. So the patients are going to be benefited with these newer techniques and technologies. And in our conference, all the faculties and the panelists would help all the delegates to master these techniques, and so they can use these techniques in their day-to-day practices. And in the end, the patients are going to be benefited, and the society also.
So I guess in my opinion, the core, or you can say the crux of all conferences to improve patient care. Why we are holding these conferences? This is not that not for networking, not for meeting foreign faculties. The core idea of conference is how best we can cater to our patients, how technology, how techniques, how these indications and experience of each other can benefit the patient. So entire conference is organized in such a way, the program is organized in such a way that ultimate beneficiaries are patients. How best we can treat. We want to learn from experiences of others. We want to learn from experiences of ourselves. We want to find out and iron out the problems in one particular technique or a disease treatment. And that is how I think each and every patient is going to benefit. So entire idea of holding this conference is to make life of a patient better.
Yes, and I think that's very, very important in these days, and I think this conference will take it to another level.
Yeah.
Yes.
And I'll just, Mayur, we have been talking about studies, technology, learning, but all study and no play makes Jack a dull boy. And Mayur, you are planning something exciting for the health and some play in the conference parallelly. Just tell us something.
Yeah, definitely. What Ajay says, I believe truly into that. A healthcare personnel taking care of the patient, but his own care he has to take on his own. And without any healthy lifestyle, no one can have that. So we are just encouraging and putting this into the life of the healthcare personnel or the person who is attending this conference, to make sure that they should also, if not at all up till now, are into the fitness stand. We are just coming up with 2-day events in the morning. First day we are going to have some routine exercises protocol, what one should be following, or how we can be benefited by that. And we are coming up with a MISSABCON marathon on the second day. So I would say this is going to be something amazing, which we are, as a part of the conference, we are going to give to our attendees, and it's, I think, going to be probably the first time which is going to happen in these conferences. So be the part of the conference, and I would say take care of yourself as an attendee.
So the crux is conference is going to take care of health of the patient and also health of the healthcare providers.
Healthcare providers, yes, the same thing.
So Hitesh, I am sure that we have so much for those who are attendees, but at the same time we have so many companions who will be joining us, our own spouses, other people. So there's a lot of things to be done. What all we will be planning? Just give an idea.
So there are a lot of excitements and other secret features which is definitely put into the conference. So like in routine conferences, you have seen that there are some kits and some gifts for the delegates, but what about that, about their companion, spouse or accompanying person? We have kept some things, some secret gifts for them also. We have arranged some city tours or some other places to visit in the capital city of Gujarat for the accompanying person, and definitely they can enjoy the scenario of the city of Gandhinagar, Gift City and other places. So these are there are a lot of attractions, as well as we know, this is a time during a Indian festival which is called as Navratri. So we have also organized an event for Garba or Navratri during the conference, along with the gala events on the next day. So there are a lot of excitements for the person who is not actually a delegate in the conference, but they are accompanying people with the delegates.
Sir, you share your planning for this conference which is about to happen. What are your plans? What are your thoughts?
We are excited, and as a team we have come forward, and what we see in the last 20-25 years, how the Spine Association of Gujarat has grown up. Pioneers like Dr. Bharat Dave, Dr. Amit Jhala, it was very difficult for patients to get convinced for surgery or even treatment, and from that platform, on those great shoulders, we have grown to those levels where we have organizations which are cultivating and grooming more and more spine surgeon and spine treatment methodologies, and that all is coming as a very big boom to the betterment of the society. Bharat bhai, what you would add to that, how the spine treatment has changed over these years from the open era to the minimal invasive?
Yeah,
and technology, of course.
I started the practice nearly 35 years ago. At that time we had the bigger incision, and now we are able to do the same procedure with a band-aid. We call it a band-aid surgery. So meaning, we can just have that small incision which may be as tiny as 15 millimeter incision. So that has been the era from my days to the current days, and that's the change which is constant change which has happened over the period in the medical science. So, and that has given precision, safety and less tissue trauma to the patient, and patient care has been very well taken care of. And along with that, we are able to do practically everything because of the technological integration as well. And technology has brought lot of good ideas, lot of new things into the patient care.
35 years of experience, and from then till now, minimally invasive technology that it is, we are talking about it. Sir, I would like to ask you that what are the key things that you are looking forward to? कि ये चीज़ होगी तो मज़ा आ जाएगा conference में. What are such things that you are looking forward to in the conference?
So the first and the foremost thing, because it's a scientific conference, the main focus has to be on the scientific program. And if your scientific program is niche, I think you can attract all the, because we are all surgeons and we all want to learn. So the best and the biggest, and even I feel that whatever program that we are giving in this conference is one of the best that I have gone through all the meetings. So I think the scientific program has to be the best if you want your conference to be of the highest order.
So I guess we started this MISSABCON took its birth in the same place in Ahmedabad in 2014, right? So it was an infant. Now it is entering a teenage. So we want to see from this conference, how that infant has grown to be a teenager, and we look to be that maybe next 10 years after, when we again have it here, that adult is much more mature and ready to take on the world.
Amazing, and so much insights we got about this MISSABCON 2024 conference, and there are a lot of surgeons and attendees that watching this and listening to us. So I would like any of you to please convey one message from your side to all the surgeons that watching this and watching us right now.
So if you want to learn any new minimally invasive technique which is present in the world as on today, I think this is the best conference that one has to attend.
If you really want to master the technique, the workshop are the best, and it is with 1:4 ratio. So you will get to know and learn the most.
Here we have given so much choice, you will actually be difficult for you to decide whether I should be attending the main hall or should I be attending the hall C. And the workshops on day 1, they are the master blaster, and that is where you are getting a free workshop. You do not have to pay a single penny for it. So that's, I think, is the best thing about the conference.
I guess we have best of the best from each corners of the world. So let's come together and learn from each other.
Be open-minded. The world is changing from open surgical era to minimal invasive surgery. So be open-minded, embrace the change and learn new techniques in minimal invasive surgeries.
I think you can learn something, or you can even probably say strengthen your belief in something by coming to this conference.
The free cadaver courses is going to be the main highlight of this program, and along with that, each and every technique has been given ample time and ample lectures. So whatever you are interested in, just focus on that and master the techniques with the lectures and with the porcine lab.
It is the MISSABCON is first time bringing an umbrella of more societies who are individually also flourishing, and they have all come together in the minimally invasive world here, like the ESFI there, the BASE there, the ASSI. There are so many number of societies which are coming together. So the learning is going to be combined, and that is a very big way forward.
Right, and so many opportunities to learn and grow together. Sir, many of the surgeons and the students have already enrolled for this conference, and now I would like you to just tell everyone, those who have not registered till now, they can register by following some links, and what are the key dates of the conference, and ask them to register right away.
Don't sit on the fence, just jump. It is just a press there, scroll down, and you have to register 16th to 19th October. Don't forget, be at Gandhinagar Leela, a marvelous property to see, an academic excellence you can visit to, and be with us to the pioneering world of the minimally invasive spine surgery, and it is just a click away. Please join us.
Welcome to MISSABCON 2024.
Welcome to MISSABCON 2024 and enjoy the marvels of spine surgery.
Amalgamation of technique and technology.
Superb, lovely.
Change is the change which we really need to bring in. So let's have the change.
Amazing, definitely, and there will be a lot of participation in this. Thank you so much, everyone, all the experts, dignitaries present here, for joining in and sharing your insights and your knowledge with all of us. And those who are watching us, don't forget to register yourself for MISSABCON 2024. See you all at MISSABCON 2024 right here in Gujarat, Gandhinagar, from 16th October to 19th October. See you all.